Here's something that might shock you. 72 hours after your last opioid dose, your brain is experiencing withdrawal symptoms that are 10 times more intense than what you felt at 12 hours. Most people think withdrawal gets steadily worse, then better. The reality? It follows a completely different pattern that even some healthcare professionals get wrong. I'm Dr. Ferghal Armstrong, and today we're breaking down the evidence-based timeline of opioid withdrawal. You'll learn why the experience varies so dramatically between patients and what actually is happening in your brain at each stage, and why common beliefs about the withdrawal process can actually harm treatment outcomes. Before we dive into the hour-by-hour breakdown, let's understand why withdrawal follows such a specific pattern. When you use opioids regularly, your brain's reward system adapts by reducing natural endorphin production and changing receptor sensitivity in your locus coeruleus. This tiny brain region controls your body's stress response. During withdrawal, it goes into overdrive because it is no longer suppressed by opioids. That's why you get the racing heart, sweating, and anxiety. The timeline depends on how quickly the opioid clears your system and how long your brain needs to readjust. Now here's where it gets interesting. That brain region I just mentioned, it's about the size of a pea. But when it's dysregulated during withdrawal, it can make a 200-pound person feel like they're dying. Let me show you exactly what's happening hour by hour. Hours 6 to 12, the early warning system. For short-acting opioids like heroin or immediate-release oxycodone, withdrawal typically begins within 6 to 12 hours. Your brain is starting to notice something's missing. Early symptoms include anxiety, restlessness, muscle aches, and drug cravings. You might also experience a runny nose and difficulty sleeping. These aren't just psychological. Your sympathetic nervous system is becoming hyperactive as opioid levels drop. Here's what's crucial. If you're dealing with long-acting opioids like methadone or sustained-release formulations, this phase might not start for 12 to 48 hours. This delay often catches people off guard. But here's what catches even experienced clinicians off guard. Just when the patients think that they're through the worst of it, their brain has other plans. Hours 24 to 72, the peak storm. This is where most people expect withdrawal to level off. Instead, symptoms typically peak between 48 and 72 hours for short-acting opioids. Your locus coeruleus is now in full panic mode. Physical symptoms intensify dramatically. Severe muscle and bone pain, nausea, vomiting, diarrhea, dilated pupils, and what patients describe as feeling like their skin is crawling. Your body temperature regulation goes haywire, causing alternating chills and sweating. And here's one system that deserves special attention: restless leg syndrome. Between 24 and 72 hours, many patients develop this irresistible urge to move their legs, accompanied by an uncomfortable sensation deep in the muscles. It's not just restlessness, it's a specific neurological response that peaks during this window and can make sleep nearly impossible. The psychological component is equally challenging. Drug cravings peak during this window, and many people experience significant depression and anxiety. This is your brain desperately trying to restore what it perceives as chemical balance. Days 4 to 10, the gradual descent. After the peak, physical symptoms begin to improve, but this phase has its own challenges. Sleep disturbances persist, and many patients experience what's called Anhedonia, the inability to feel pleasure from normal activities. Your dopamine system is still recovering. Activities that once felt rewarding now feel flat or empty. This isn't weakness or lack of motivation, it's your brain's reward circuitry slowly rebuilding its natural function. Interestingly, restless legs often persists into this phase, though it typically becomes less severe. The uncomfortable sensations and urge to move can continue for 7 to 14 days, gradually improving as your nervous system stabilizes. Gastrointestinal symptoms often linger during this phase. Your gut has its own opioid receptors, and they take time to normalize. This is why digestive issues can persist even after other symptoms improve. The hidden phase, post-acute withdrawal. Here's where many treatment programs fall short. Post-acute withdrawal syndrome, or PAWS, can last weeks to months. Research shows that up to 90% of people experience some form of prolonged withdrawal symptoms. PAWS involves mood instability, sleep disturbances, cognitive difficulties, and ongoing cravings. These aren't signs of treatment failure, they're evidence of your brain's neuroplasticity in action, slowly rewiring itself back to baseline function. The prefrontal cortex, responsible for decision-making and impulse control, can take months to fully recover. This is why relapse risk remains elevated long after acute symptoms resolve. Before we go further, I need to address 3 beliefs about withdrawal that are just wrong. They're actively harmful to patients. The third one might change how you think about recovery entirely. Let's address 3 myths that can seriously impact patient care. First, opioid withdrawal is life-threatening. Unlike alcohol or benzodiazepine withdrawal, opioid withdrawal is rarely dangerous on its own. However, dehydration and co-occurring medical conditions require monitoring. The second myth, withdrawal is just about willpower. The evidence is clear. Withdrawal involves measurable changes in brain chemistry and function. It's not a character flaw or a lack of determination. Third, and this is critical, medication-assisted treatment prolongs addiction. This myth causes real harm. Studies consistently show that medications like buprenorphine and methadone significantly improve long-term outcomes and actually reduce the duration of active addiction. Here's why. These medications stabilize brain chemistry, allowing patients to engage in therapy, rebuild their lives, and develop coping strategies without the constant cycle of withdrawal and relapse. The research is unambiguous. Opioid agonist therapy shortens addiction duration by breaking the destructive pattern of repeated withdrawal and relapse. It's not substituting one addiction for another, it's providing neurochemical stability that allows genuine recovery to occur. So why do some people sail through withdrawal in 5 days while others struggle for months with identical usage patterns? The answer involves your DNA. Why do timelines vary so dramatically between patients? Genetic factors affect how quickly you metabolize opioids. Duration and dosage of use impact receptor density. Age, overall health, and co-occurring mental health conditions all influence the withdrawal experience. Safety considerations are crucial. Medical supervision is essential, particularly for individuals with heart conditions, respiratory issues, or mental health concerns. The risk of fatal overdose increases dramatically if someone returns to opioid use after a period of abstinence due to reduced tolerance. Understanding withdrawal timelines helps healthcare professionals provide better patient education and support. If you're working in addiction medicine or want to learn more about evidence-based treatment approaches, subscribe to MedHeads for the latest research and clinical insights. What's your experience with withdrawal management? Have you noticed patterns that align with this timeline or variations that surprised you? Share your thoughts in the comments below. I'm Dr. Ferghal Armstrong and this has been Cracking Addiction.